It is never easy for a parent to comfort their sick child. You want them to be content, healthy, and ready to play. When your little one has a fever, it can be especially difficult because they are too young to express how they feel or what they need to be comfortable. Therefore, it is your responsibility to calm them down and bring down baby fever so they can feel better as soon as possible. In this video, we're going to go over the signs, symptoms, and how to treat a fever in your new baby. Let's get into it. A baby's normal temperature is 97 to 100.4 degrees Fahrenheit, according to the American Academy of Pediatrics. If you're not sure what temperature constitutes a fever in a baby, and as a result do not always manage the specific situation properly, here are 3 things to keep an eye out for. A temporal artery, ear, or rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. An oral temperature of 100 degrees Fahrenheit, 37.8 degrees Celsius, or higher, and an armpit temperature of 99 degrees Fahrenheit, 37.2 degrees Celsius, or higher. If you have any doubts about a temperature reading, use a different method to confirm the results. It's important to remember that a fever is not a disease or illness in and of itself, but rather a sign that something unusual is going on in your baby's body. The appearance and behavior of your baby are more important than the temperature. A fever is usually an indication that your child's body is fighting an infection. It is the body's natural defense mechanism against infections, and the high body temperature makes bacteria and viruses that cause infections more difficult to survive. A fever or high temperature may develop gradually over a few days, or it may develop rapidly. It may also fluctuate throughout the day, and these things are usually unrelated to the illness that is causing the fever. A high temperature may make your child feel uneasy, and when your child's temperature rises, they may experience chills or shivers, and when it falls, they may sweat. If your child is losing a lot of fluid due to the fever and not drinking enough, they may become mildly dehydrated. As you gain experience, you can often tell if your baby is warm simply by feeling them. Of course, babies get hot and sweaty after being in a hot room or being overdressed. However, the majority of babies who feel warm but do not have a fever have a normal digital temperature. A digital thermometer is an absolute necessity in your baby's first aid kit. Here are some things you can do if you wake up in the middle of the night wondering how to bring down your baby's fever. We encourage you to talk to your pediatrician or doctor about using baby fever medicine, but don't always dismiss home remedies for baby's fever as an effective way to lower your baby's temperature. Giving your baby a fever reducer may help bring down the fever. Before giving Tylenol to a baby under the age of 6 months, consult your doctor or pediatrician. They will most likely want to examine your child in person to determine the cause of the illness before prescribing your baby a fever reducer. If your infant is over the age of 6 months, you can give them a fever reducer without consulting your doctor, but that decision needs to be left up to you. Keeping your baby hydrated is another key step in making sure that the fever is reduced effectively and efficiently. A fever can cause your baby to quickly lose fluids and become dehydrated. This can lead to serious complications and symptoms worsening. To avoid this, provide fluids as needed to keep them hydrated. Keeping your baby's clothing light is also a key step in making sure that the fever is reduced. Remove excess clothing to allow your child to lose heat more easily through the skin. Because infants can't regulate their temperature well, cooling them down with multiple layers is more difficult. Always dress them appropriately to your local climate and consult your doctor if you have any questions. And allowing your baby to get plenty of rest will also help reduce the fever. Give your baby ample time and room to sleep quietly. Reduce the amount of lighting in the baby's room and use heavy curtains or blinds to block out noise and light. When your baby has a fever, avoid taking them outside, as rest is essential because it allows the body to heal and repair itself naturally. Ultimately, bringing down a baby's fever is about keeping your little one comfortable and preventing their temperature from rising too high. We hope you enjoyed this video and encourage you to like and subscribe. Don't forget to visit momswhothink.com for parenting advice, recipes, and more. Thanks for watching.